You already know that informed consent is one of the most important things to review with your clients at the very start of therapy. But how much do you actually need to review? What goes in that form? Does it need to be this long form full of legalese? Hi, I'm Dr. Maelisa McCaffrey, founder of the free private practice paperwork crash course, and today I'm going to share with you the 14 things you want to have in your informed consent document. Now, obviously, this is just one of the forms you need for your whole intake process, and we reviewed all of the forms you need in last week's video, so we'll link to that in a card here or down below, so go ahead and click that if you haven't watched that video yet. Number 1, limits to confidentiality. You need to outline exactly when you might need to break your client's confidentiality. Now, usually this happens when you have to make a child abuse report or when someone is suicidal and might harm themselves or even harm someone else. These are fairly general and common for all of us in the field, but there are nuances depending on your state and your profession, so you need to make sure you're very clear on what those limits are and outline them very specifically in that document and review them verbally with people to make sure that they understand it. Number 2 is the risks and benefits of therapy. Yes, there are potential risks and benefits to being in therapy, and your client may not have considered both of those things. Now, you don't have to go into a ton of detail here, but for example, one common thing that does happen is people make major life decisions or learn great things about themselves from being in therapy and then might change their mind about certain beliefs they have or actions that they're taking currently. The key here is you just want to let people know you can't promise that therapy or counseling is going to be all sunshine and rainbows and that everything in their life is going to be perfect and turn out great just because they're going to see you. It probably will, but we can't guarantee it. The third thing is your scope of practice. So are you a psychologist? Are you a licensed professional counselor? There are a million different names for all of the different fields and licenses in all the different states. So just clearly outline who you are and what board regulates you. The fourth one that you've probably heard a lot more about recently is what are your expectations for the length of treatment and the assessment period? So for example, some therapists are pretty clear that one session is kind of the assessment intake period and then they're done and they start doing therapy. Other therapists feel very strongly that they need 2, 3, maybe 4 sessions to complete an intake or a full assessment. So let clients know what that means for you and how you work, as well as are you fairly clear that you could probably work on something in 6 to 12 months? Or is it more like a 3-month time frame? Or are you thinking more like multiple years? That is going to depend on how you work and on your client's specific needs. You just want to give people some general guidelines on how long they can expect to be in therapy with you. Number 5 is what is your policy around cancellations, no-shows, and people showing up late? So you want to clearly outline if someone shows up 15 minutes late, is that the same as showing up half an hour late? If they show up 40 minutes late and you do a 45-minute session, are you going to see them for that 5 minutes or is their session already canceled? If someone cancels a session, is 24 hours notice good enough for you? And if they offer that 24 hours notice, does that mean that they're charged at all? Do they get to reschedule within that week, or have they already given up their time slot for that week and maybe nothing's available that week? These are the things you want to outline and let people know about. Also, think through what are the best methods for contacting you regarding these things. So do you prefer text, email, a voicemail? Will you accept any of those, or will you accept only one of those? You can do whatever works for you in your practice. You just need to make it very clear at the beginning. 6 is emergency contact information for a different therapist in case you are out of commission. So you may not need to write all the details about this other therapist, but letting people know that if you're out of commission, you have a plan in place. And so you've thought about who you would contact. For example, if you ended up in the ER one day and couldn't show up for sessions, who's going to call your clients and let them know that you are out of commission and maybe try to reschedule with them or check in with them. 7 relates to what we talked about earlier, communication outside of the office. So how do you contact clients to communicate perhaps if you are planning to be out of the office, or maybe to remind them about a vacation you have? And how do you expect them to contact you if they need to cancel a session, but also if they have an emergency, or if they have an emergent need they want to tell you about, but they don't necessarily need to cancel, or it's not urgent? And again, you can do this however you want. It could be email, it could be text, it could be phone, it could be all three, or just one of those, or two of those. But choose something that you will stick to and that makes sense for you and your clients. 8 is social media. So personally, I don't believe you need to have a huge social media policy, but I do think it's important to acknowledge if you are on social media or not. And if you do have a social media presence, where that is, so where you maintain maybe an Instagram page or a Facebook page, and to acknowledge that you do not discuss clinical matters with clients publicly or privately via that method. The key here is really making sure that people understand if they leave a comment on a post that you are not going to reply, because you don't want to make it obvious that they're your client. And you want to recommend to them that they don't make it obvious that they're your client. Of course, people can always choose to do that if they want to, but that's not the ideal way to interact with you, because you'd prefer they contact you in session to talk about things. Also, you want to let them know that you don't expect them to follow you on social media. You are not expecting that they'll come in and have done homework, like asking you about a TikTok video or Instagram post that you made. And vice versa, you want to let them know that you do not follow or friend or interact with clients on social media in any way. So you will also not be going onto their channels and seeing what type of things they are posting. If they'd like to share that with you, that's very welcome, and they can do that with you in session, but it's not something that you are doing outside of session at all. Okay, 9 is a big one, and that is payment and insurance. I put these two together because they are fairly intertwined. So payment, you want to outline exactly how much you charge for a session and when that payment is due. So do you expect people to give you a credit card number and you will charge it at the beginning of each day? Do you charge it after they leave for that session? Let people know so that they know what to expect. And if for some reason you're not accepting credit cards yet, then let them know how else they should pay. Related, for insurance, here's where you really want to outline one of two options. Do you contract with insurance or do you not contract with insurance? So if you do contract with insurance, let them know I contract with the following insurance panels, and I will bill that insurance panel directly, and let them know if they have any type of a copay, how that process goes. If you don't contract with insurance, then you want to outline whether or not you will provide a super bill or a form that they can submit to their insurance company for reimbursement. This is not something you're required to do, but you can do it, and most therapists do this. And regardless of whether or not you're doing a super bill or you're directly contracted with insurance, you want to let people know some of the limits to confidentiality that are specific to insurance in these circumstances. For example, if you submit anything to an insurance company, you will have a diagnosis. So you as the therapist will be providing the insurance company a diagnosis, a mental health diagnosis on that form. That's very important for a lot of people to know and understand. Also, you want to let them know that by allowing their insurance company to pay for their services, they are opening up their therapy records potentially to that insurance company. So there's a little bit more there, but those are the two major things you want to cover with insurance. Again, whether or not you're contracted with an insurance company, if you are offering a super bill, those two things still apply, and it's your job to make sure your clients understand that. All right, number 10 is a court policy. So you want to identify, do you go to court or not? If you say, no, I don't go to court, obviously we all know if you get a subpoena, you still have to answer a subpoena. If you are mandated to go to court, you're still going to be going to court, right? So even if you say no as part of your court policy that I do not go to court, you still want to outline, and if I am subpoenaed or required to go to court, how much you will charge. This is really, really important because I see so many therapists who end up spending hours and hours on court-related matters, whether it's writing something up or copying records or actually talking with attorneys or the client or going to court. It's a lot of your time and it's a huge amount of stress and energy for most therapists. So please prepare, identify a fee so that you are paid for your time. And no, you cannot make your fee some exorbitant amount like $25,000 for the day when your typical session is $100 an hour just so that you can avoid court. There are different schools of thought on this, but if you want a general rule, then you can go by whatever your hourly rate is. The 11th thing you want to have in your informed consent document is the right to records. So letting your clients know that yes, you take records, yes, you will be writing notes and doing other documentation, and they have the right to access those records. Most clients don't really care either way, kind of anticipate this, or are never going to request their records, but it is really important that you let people know, yes, I do take notes about our sessions, I'm required to do so, and if you ever want to see them or have questions about them, all you have to do is let me know. The 12th thing is your governing body, and you could include this in the same area where you included your scope of practice, but this is where you want to let clients know exactly what body is in charge of you. So for example, for me, it's the Board of Psychology in California, and you want to give people the contact information for that board. 13, you just want to have a quick statement that says something like, yes, I agree to these terms and conditions. There's no need to belabor it or add a huge statement there, but you do want to have something that someone either initials or checks off, or they're going to sign right underneath that statement so it's very clear they're agreeing to that. And then 14 is their signature and the date. And obviously, if you see kids or if you see someone who has a guardian in any way, you want the guardian's signature as well. But it's really important to have those forms signed and dated. Now, after reviewing these 14 things, hopefully you feel really prepared to write your own informed consent document. But if you're not, I've got you covered. You can click below to check out my Therapist Perfect Paperwork Packet that has all the forms you need for your private practice, including a detailed but well-organized informed consent document that includes all 14 of these items. And one caveat here, remember that there is no such thing as an attorney-approved intake packet or paperwork packet. So my paperwork packet comes with a lot of details about the specific things that you'll want to adjust or change, because I am thinking through all the different states and all the different licenses that are involved, potentially even countries, so that when you open up that paperwork packet, you feel like it's something you can use really quickly, but it does walk you through all the details to how to personalize it to your needs. So click below, check it out, and in the meantime, happy writing.